This is KTVO's Good Morning Heartland.
October is National Dental Hygiene Month, and we all know that we need to brush our teeth and floss every day. But is there anything else we need to practice good oral hygiene? We have Dr. Liz Kaz, who is an Associate Dean for Education and Assessment at A.T. Still University's Missouri School of Dentistry and Oral Health, with us this morning to talk more about the importance of oral health. How are you doing?
I'm great. How are you today?
Good. So first of all, my first question is, how many times do we need to brush? You know, some people say twice a day, once when you wake up, once before you go to bed. Other people say every time you eat, after you eat. So what is the recommendation?
Well, truly, it really is depending upon on yourself and your ability to clean your teeth adequately. You know, once a day will actually work if you really do a good job. See, that's the key, is that a lot of times people don't spend the time and the effort in really brushing and cleaning their mouth thoroughly. So if you have problems brushing your teeth or getting your teeth clean, I would say at least 2 times a day, minimally.
All right. And let's talk about gum disease. What is it?
Well, actually, gum disease is an inflammation caused by bacteria, and it actually breaks down the bone which holds the tooth in place. And it's characterized by bleeding gums, puffy red gums, that sort of thing.
Okay. And so when we do notice it, should we go to the dentist? What should we do?
Well, absolutely. You know, that it's a condition that needs treatment and therapy, and you want to stop it. Once you lose the bone around your teeth, that is kind of it. It cannot grow back. So it is a condition that you want to control, and it is caused by bacteria. So, you know, we all have bacteria in our mouth. We cannot get rid of or eliminate the bacteria. We have to control it. And that's why I have all these toys here today.
And what are some ways that we can prevent? Like right here on our screen, we have the brush, floss, rinse, and chew. So kind of go through that for us.
Right. That is the theme this year for the National Dental Hygiene Month. And basically, I've brought some products in here that I'd like to share with you in terms of all of those types of routines. Obviously, brushing is important. You want to make sure that you're purchasing a toothbrush that has soft bristles. Okay? Now, there are power toothbrushes or manual toothbrushes. It doesn't really matter what you use as long as you're using it effectively and you use it at least 2 minutes a day. That's probably the recommended amount of time to brush your teeth.
So on toothbrushes, when it says soft, medium, and hard, so you want to go for the soft bristle.
You always want to go for the soft.
Why is that?
Well, if you think about how you brush your teeth, you have soft tissue around the tooth. The hard bristles can actually damage the gum tissue. So you want to brush around the gums because the bacteria will actually form around there. So you want something that isn't going to damage the gum tissue, but yet will remove the bacteria and disrupt it. The other part of the brushing is actually to brush the tongue. A lot of halitosis or malodor of the mouth is really caused by the tongue. It's kind of like a mushroom field, if you will. I mean, if you look at it microscopically, it's not very attractive. But there are products that you can purchase, like a tongue scraper, to actually remove debris from your tongue. So after you've brushed, you can use your tongue scraper. I've also brought in some little travel type brushes as well. This has a little bit of toothpaste in the center as well, and then a little pick at the other end to actually clean between the teeth. And that's the next part of this. After you've brushed your teeth and your tongue, is to clean in between, and of course, as a hygienist, always floss. But if you can't floss, there are other products out there that can actually sneak between the teeth as well. So you want to do both of those sorts of things. And there are other floss holders and that sort of thing that you can use to help get in between the teeth. We kind of forget that, and it's really critical. The next part of that is actually the rinsing. And I brought a couple of products in here for rinsing. You know, the rinses, if you've ever gone to the pharmacy or the grocery store, I mean, there's just tons of products now that you have to choose from. So what you have to do is really go to your dental professional and find out what your individual needs are. They may recommend one that's designed for gingivitis. Maybe you want to use one that actually will do some whitening. There's fluoride products for anti-cavity. So you have a variety of different products that you can use. The last part of this whole regimen, believe it or not, is to chew gum.
And you say sugar-free gum.
Sugar-free gum, absolutely. Look for the sorbitol or xylitol product. Chewing gum does a lot of good for you. it creates a lot of saliva in the mouth, and saliva has a rinsing factor. It also produces a lot of the minerals that you need to remineralize your teeth. So they say about 20 minutes after you eat or drink something sugary, just pop in a stick of gum, chew for 20 minutes, and you've neutralized all the acids in the mouth.
Wow.
And you rinse away a lot of the bacteria.
All right.
So
Well, that is some useful information.
great.
All right. Well, thank you so much for your time.
Thank you.
And we'll post all of this information on our website at heartlandconnection.com.